I want to talk to you about a serious but often overlooked condition that every expecting mom should know about. Hi, I'm Dr. Amanda Huynh, Assistant Professor in the Department of Medicine and an OB Med internist at McMaster University. Have you ever heard of a condition called preeclampsia? It affects about 1 in 20 pregnancies. The good news? If caught early, it can be managed effectively. So, what is preeclampsia? Simply put, it's high blood pressure and often protein in the urine, usually after the 20th week of pregnancy. But it's more than just blood pressure. It's a state of inflammation that can affect multiple organs, including the brain, liver, and kidneys. This inflammation can lead to serious complications like seizures, liver damage, kidney failure, and it can also affect the placenta, restricting nutrients and oxygen to the baby. Warning signs can be subtle, so it's important to know what to look for. Sudden swelling in your face or hands, severe headaches that don't go away, blurry vision or seeing spots, chest pain or shortness of breath, pain in the right upper quadrant, and nausea and vomiting. These symptoms often appear alongside high blood pressure above 140/90. If any of these occur, contact your healthcare provider immediately. Preeclampsia is serious. Untreated, it can cause organ damage, stroke, or seizures for mom, and premature birth, low birth weight, or stillbirth for the baby. Catching it early is critical. Certain factors increase the risk of developing preeclampsia. High-yield risk factors include first pregnancy or pregnancy with a new partner, previous preeclampsia, chronic high blood pressure or kidney disease, type 1 or type 2 diabetes, obesity, multiple pregnancies with twins or triplets, maternal age over 35. It's also important to know that having preeclampsia once increases the risk in future pregnancies, roughly 15 to 20%, depending on severity and timing in the first pregnancy. Early detection allows healthcare providers to monitor, manage, and intervene before serious complications occur. This may involve blood pressure checks, medication, or even early delivery if needed to protect both mom and baby. And it's not just about pregnancy. Preeclampsia can signal long-term health risks for the mother, including high blood pressure, heart disease, diabetes, and stroke. Raising awareness about preeclampsia saves lives. So share the warning signs, talk to friends and family, and empower expecting moms with knowledge.